rights. And when it comes to digital health, when it comes to human rights and understanding the global perspective, who better to discuss it with than the world's one of the newest private astronauts, but Glen de Vries, someone who understands not only medical technology and digital health, but also now space travel. Let's add that to his the Renaissance man's many different skills and endeavors. And now, Glen, now that you've been able to see the globe from, I don't know, 80 miles out, out in space, and you can have that perspective for global health and seeing all 8 billion people. First, tell us a little bit about your trip and what that was like, and hanging out with Captain Kirk for a few weeks.
Sure. Thanks for having me, Stan. And yeah, 60 something miles, not quite 80. It was incredible. And I'll tell you, just from the kind of that global perspective, and this is kind of the very top of the arc that we flew. I was mentally prepared. People had told me it would be like this. When you see how thin the atmosphere is, you start to see the curve of the Earth, and you can kind of see through part of the atmosphere, and obviously the blackness and vastness of space past it. It is hauntingly, almost terrifyingly small, and you definitely get this sense that the world is both welcoming, and that feeling that you get with the word home is incredibly profound, but precious and alone in this kind of vast emptiness. And so if you need something to inspire you to make sure that we preserve the planet the way we want it to be, or to realize that we are all part of this single civilization that is tasked to do that, needs to take care of each other, that perspective definitely helps. And I'll add that just one other thought, which is I was thinking about the top of this journey. I wasn't really thinking the same way about going up and coming down. And it was actually a spectacular part of that kind of understanding. You sit next to this window and get to see, it's almost like something that you see in the Men in Black movie, or animations about science. It's just like continual zooming out and going from human scale, where you can see a cactus and see things that make sense in our normal life, to what you only see from airplanes, and then you see weather systems and the Earth drop away, and you're zoomed out to this giant thing, and you see that curve in the horizon, and back the other way. Look, it was a relatively short trip. It was about 10 minutes. I think I'm going to be honestly processing that 10 minutes for a really, really long time, and certainly trying to incorporate it into everything I think about and do in my life moving forward.
Incredible. Glen, you were already inspirational, especially those of us from the Columbia University Medical Center community, starting out as a research associate, and then obviously running up one of the most influential companies in digital health history, Medidata, and obviously now and no one's really told this story, but if it weren't for Medidata and the clinical trials digital infrastructure that Medidata was able to provide during these clinical trials, during the vaccine deployment and research, who knows where the vaccine would be? Would we have actually developed a vaccine in less than a year? So inspirational in medical science and technology, and now inspirational to everybody on the planet for really what you're describing, articulating as truly an extraordinary human experience, one which very few people can even imagine, and being able to articulate as well as you have is wonderful. And now, with that perspective, and with the theme of what we're talking about today, is really trying to escalate the conversation around how digital health can improve human rights for all 8 billion people. You've now seen all 8 billion people from, again, 60 plus miles in space. Tell us a little bit about, as a data geek, self-described data geek, how do you bring what healthcare data, what digital health can do to, and what you do, and what you've started with Medidata now over 20 years ago, how do you bring that back into this idea of bringing these technologies to all 8 billion people? What do you think we can do there?
Yeah. So first, thank you. I mean, your comments are very kind. I'm sure we would all get there. At Medidata, I hope we did our part. And when I say that, like, I hope we did our part, I think one of the important things in the health community, in the life sciences community, certainly I think in everybody, myself included, but many colleagues from decades now in it, really care about is creating opportunities, creating equity and access in healthcare. And I think we learned this really important lesson, again, as that almost global civilization, about how digital is so important to that, right? So I think, simply put, we all had this assumption that you needed to be in the same room as a provider for healthcare. And maybe that's a hyperbolic way to say it. And yes, people were doing telemedicine, and yes, people were measuring things about patients in their homes and interacting with people in different ways. But I'll say on the other side, if I was wrong about that assumption, there wouldn't be Doctors Without Borders. That wouldn't be a thing, right? And so we had this idea that geography was important. Actually, when we were together in one of Columbia business school classes, right, we were talking about these maps that somebody published in Nature Medicine that showed parts of the Earth that were bright and parts of the Earth that were dark, and all the shading was based on whether you could get to a hospital by foot or whether you could get there in some kind of vehicle within a day. And a frightening part of the world was dark. And so now all of a sudden we learn this lesson, as I said in the beginning, I'll get back to, of that this assumption that, here in downtown New York, where right now I can walk to a whole bunch of really good academic medical centers. It might take me a couple of hours, including Columbia, where we used to work. That's a bad assumption. It could be that you aren't allowed to go there. It could be that because you have something suppressing your immune system and everybody there has an infectious disease that you want to get, you don't want to go there. It could be that it's full. And so I think we've had this awakening that some of these technologies that people have been talking about and certainly, to their credit, using and trying to apply, are things that we can and need to turn into the rule, not the exception. And if we get rid of this idea that geography is a critical element in the provision of care or just the diagnosis of disease, that's the data geek in me is saying, what can we collect and look at individuals and populations remotely, and how can we figure out who needs care and what they need to get? Then we can take that map of Earth and we can turn it all bright, where it doesn't matter where people are. It doesn't matter whether we can get in the same room as them. And frankly, I think if you look at the really exciting therapies that people are thinking about, yes, we're going to have ones that continue to sometimes be complex or require somebody to be in a clinic for an infusion or a complex procedure, and there'll be diagnostic machines that you can't use over an iPhone. But those technologies are going to keep getting better and smaller and more portable and sendable. And the therapies themselves, I think, are going to get easier and easier to provision and track. And so I feel like we're in this moment where this lesson actually had all the ingredients it needed to turn into learning and acting better from this access perspective. I think it's a super exciting time in that regard, because the whole world is behind making this work, and digital medicine is in the very center of all that.
That's so exciting. And again, someone who's and literally influenced digital medicine, medicine for people using digital now for the last 20 plus years. What do you think we could do better in terms of getting ready for the next either epidemic here in the United States or pandemic globally? Now that we're in this endemic culture, clearly, there's a lot of things that we're really trying to grasp and understand here. And one of which is how to respond to these situations. And from your perspective, and I hope you're writing a book on this, because I know you've written one book. It was brilliant. I hope Scott Gottlieb has written we've got a number of books coming out from a number of people, but Gottlieb wrote one, also brilliant. But how can we as a nation, how can we as a global human society, as you've now illustrated from your journey to space, be better prepared to use digital to battle these pandemics?
Yeah, thanks for mentioning the patient equation. Appreciate it. And actually, my book was supposed to come out at the beginning of the pandemic, and actually, the printer, not the publishing company, the printer went out of business, and we actually had to revise it a little bit. And one of the things that was a little bit scared to put in, because it's kind of scary to write about something that hasn't completely finished happening yet, and frankly, it still hasn't. But I unfortunately think it's going to turn out to be correct. is that we really kind of blew it from a data perspective in terms of COVID. And I point the finger of accusation at myself amongst everybody else in the life sciences industry, right? So here we were collecting data, and we are, by the way, every day now still on diseases in every part of the world in practically every single indication. And yes, COVID-19 is a particular condition that is caused by a particular virus, but it exists in us along with the diabetes and the cancers and the flus and the high blood pressures that so many people live with every day and are either trying to manage from a chronic perspective or take care of if it's a life-threatening condition. And there's all this research going on. And honestly, my experience and if you could say expertise is much more on this research side, but so I'll focus there. But I'm sure this extends across other parts of the digital data landscape. If we had just looked at all of those clinical trials that were happening everywhere in the world in every therapeutic area, we would have seen more people having fevers. We would have seen more people using analgesics. There is not a clinical research project on planet Earth that doesn't have two data sets, one which is called concomitant medications or something just like that, and something which is called adverse events or something that sounds just like that, that include the start and the end of when somebody was taking any kind of medicine, prescription or non-prescription, and the start and end of any kind of effect, whether it's related to the therapy or the disease that's being studied or not. If we could stack those up, I think in retrospect, we would have been able to go see exactly where COVID-19 was spreading and exactly who was or wasn't suffering from it to different degrees. I mean, I even think this would have been helpful and maybe one day still can be, although it's not in the time frame where we could take action that much earlier. It's like who actually was more at risk. I mean, I put myself in the same bucket a couple of years ago. The answer was, well, if you have a compromised immune system, you're more at risk. And if you're older, you're more at risk. And I'm sure that everybody in this call knows people who unfortunately suffered or died who fit in those two categories, but you probably know people who don't. And it's going to be decades maybe before we really figure all that out. And I hope we've learned our lesson. We start to think more proactively about how we can use data sources. And I hate to be, I try to be a pretty positive, optimistic person. Frankly, I'll give a glimmer of hope in that regard, and that I think it has been also kind of that lesson that has inspired learning. And one of the things that I know from Medidata's perspective, we've seen a renewed interest in is pooling of research data. So it's not quite at the point to detect the next pandemic yet, although people are talking about that, but we have people who are pooling data in rare diseases and difficult to treat cancers, realizing that if you create a big enough denominator, yes, you can avoid, if you have what we might call a synthetic control arm. You take patients from people who volunteered for studies A, B, C, and D and use them as a control for study D in the same, or A, B, C, D, and A, and use them for control for study E in the same therapeutic area. You can avoid giving people something that might be not effective or harmful. But you can also discover new things. You can do, because you have this bigger denominator, you might be able to figure out who is a better candidate. We really had to do that precision medicine of who gets the right therapy at the right time in a better way. And so I do think we're moving that direction. Again, I think now it's incumbent upon people who are doing research and the people who are building digital infrastructure to do that data stacking that I'm talking about, which isn't always trivial, and to use it in the analyses that they're using to kind of show safety and efficacy.
That's fantastic. And that really does go toward the broader point here, which is that better response to the pandemic requires a better, not just digital infrastructure, but also the protocols, the methodologies, that we use within that infrastructure. So it is really more complex than probably most people can even fathom. But, outside of people like you who are uber geniuses and have the ability to understand things like that in ways that are just spectacularly complex, but very important. So we've got a couple of minutes left. And, with the newest best friend of Captain Kirk, we need to ask you, since you just went to outer space with him on Blue Origin, give us your predictions, Dr. de Vries. I guess we want to know what's your your future predictions for digital health, whether it's automation or therapeutic delivery or whatever. What are you predicting for digital health and being able to really affect human rights globally for all 8 billion citizens of this blue planet that you saw from 60 miles above the surface?
Yeah, well, one thing that I think, again, is another really positive thing is as we think about these decentralized clinical trials and starting to do all these things from a population level, what can we detect remotely? How can we see what's happening? There's a huge component of the individual. And we're also now seeing people really use things like sensors that, frankly, things that in a lot of cases came out of the aerospace industry. If you're wearing an Apple Watch, you're wearing some technology that was like developed and put in the Apollo program, 40 years ago. Just FYI, it's just much smaller, and now it fits in a thing on your wrist. But I think we're going to see these devices and the things that surround us. And this is not something that only happens in certain socioeconomic classes or geopolitical parts of the world. I was just in before the pandemic, like North Africa, and everybody's got a smartphone. And I think what we're going to see is we're going to start to be able to look at the complete person, also remotely, also a lot more carefully, and see every element of maybe their genotype, but certainly a very broad spectrum of their phenotypes, where we can look at patterns that include the biochemical and the behavioral and the cognitive from a digital perspective. It is going to give us a much better lever by which we can really figure out, as I was saying before, that same thing: who needs the right treatment, who needs treatment now, who needs treatment later, what's the best one? And I think this idea of bringing precision medicine, not just to the privileged, but to all, is another dimension that this kind of digital health really unlocks. And I know that a lot of people who are here today are very dedicated to that. Certainly, I am, and I just can't help but say, but Bill Shatner is a wonderful guy. I love that I went to space with the guy who played Captain Kirk, because I think it should inspire everybody that what was science fiction, this character, now is science fact, the guy who played him, who went to space. But I'll say that, now my friend Bill was a great guy to go with. He's not Captain Kirk. And everywhere that we have science, we need people who understand art and expression to really have these kinds of dialogues and do stuff together. So I hope that's also something important for the world. So thanks for hosting this and getting everybody together, Sam.
No, wonderful, Glenn. And again, an inspiration not just to the medical technology community, now an inspiration to everyone on planet Earth. Thank you very much. Glen de Vries from Medidata, co-CEO now, one of the newest private astronauts. Glenn, live long and prosper. Thank you for joining us.
Thanks, Dan. I'll Charles, see you soon. Take care. Thanks, everyone.
Looking forward to seeing you go to Mars soon as well. And that'll be a super blast too.